Hi everyone, and welcome to my presentation. My name is Dr. Shiba Hadadian, and today I'm going to concentrate on a set of symptoms that many women report 1 or 2 weeks before their period. So let me share my slides. Okay. As you can see on the screen, our topic today is premenstrual syndrome in women. First of all, it's better to know what premenstrual syndrome or PMS is. PMS is a combination of physical and mood changes that many women report about 1 or 2 weeks before menstruation every month. These symptoms usually go away within 4 days after the period. Mild PMS is common, and it is estimated that 75% of women of reproductive age suffer from it. The cause of PMS remains unknown. It is believed that women with PMS are hypersensitive to the normal hormonal changes of menstrual cycle. Research shows that serotonin, a brain chemical neurotransmitter, plays a role in premenstrual syndrome. Low amounts of serotonin may lead to premenstrual depression, food cravings, and other symptoms of this syndrome. Now it's time to talk about signs and symptoms of PMS. What are the emotional and behavioral signs of PMS? A girl suffering from PMS might feel moments of irrational rage, fighting loved ones for no reason. She might be more emotional and start crying while listening to sad music. Depression, anxiety, social withdrawal, poor concentration, insomnia, changes in sexual desire, and mood swings are other behavioral symptoms of PMS. PMS has some physical manifestations as well. Breast tenderness, headache, fatigue, belly bloating, food cravings, acne, weight changes, constipation, or diarrhea are common physical symptoms of PMS. Now the question is, who is prone to PMS? PMS symptoms mostly appear in the late 20s to mid 30s. Women with a family or personal history of depression and women who have high levels of stress are more prone to this disease. Many people would like to know if their symptoms get worse with age. If you're approaching menopause, your PMS symptoms tend to change and worsen. Fluctuation in hormone levels is responsible for this. Now let's see how the PMS is diagnosed. There is no test to diagnose PMS if you have symptoms in the 5 days before your period for 3 menstrual cycles in a row, and these symptoms end within 4 days after your period starts, and your symptoms interfere with some normal activities. You probably have PMS. Please note that other diseases such as depression, anxiety, thyroid disease, and irritable bowel syndrome may also mimic PMS symptoms. Depression and anxiety disorders are the most common conditions that overlap with PMS. Now, let's answer the most common question: is PMS treatable? If your symptoms are mild to moderate, you can control your symptoms by changes in lifestyle or diet. But if your symptoms are severe and interfere with your life, it is wise to seek medical treatment. In more severe cases, your OBGYN may recommend medication. At this moment, let's talk about lifestyle changes that help control PMS mood swings. First, exercise daily for at least 30 minutes more days of the week. Second, try to substitute your junk cravings with eating fruits and vegetables. Third, try to have at least 8 hours of sleep at night. It's a proven mood booster. Fourth, try to avoid stress. Unmanaged stress can worsen PMS symptoms. Now, I'm sure you're curious to know which foods make your PMS symptoms worse. Processed foods like cookie, donuts, and soda cause a rapid rise in blood sugar levels, aggravating PMS symptoms. Spicy food, milk chocolate, alcohol, French fries, pizza, and red meat do the same when eaten prior and during your period. So, what are the best foods for PMS? Foods with complex carbohydrates such as whole wheat bread, pasta, cereal, barley, beans, and lentils may reduce mood swings and food cravings. Dark chocolate, avocado, and calcium-rich foods such as yogurt, almond, and leafy green vegetables also help control PMS symptoms. Research has shown that magnesium and vitamin B6, when taken together, may reduce PMS symptoms as well. Now it's time to answer these questions. What is the best herbal tea for PMS? Chamomile tea helps reduce PMS symptoms. Is coffee good for PMS or not? Some PMS symptoms like insomnia, mood swings, and digestive problems may be aggravated by the consumption of caffeine. So, American College of Obstetricians and Gynecologists suggests that those suffering from PMS should limit their amount of caffeine. Did you hear about the premenstrual dysphoric disorder or PMDD? What is the difference between PMS and PMDD? PMDD is a severe form of PMS. It causes extreme mood shifts that affect daily life. With PMDD, it's difficult to work, socialize, or have a healthy relationship. In some cases, it may also lead to suicidal thoughts. And finally, what medications can help reduce PMS syndrome? Antidepressant, NSAIDs, diuretics, and hormonal contraceptives are the most commonly prescribed medications for PMS symptoms. But remember, you should talk with your doctor before trying any medication for PMS. Thank you for your attention.